Hi, everyone, and welcome back to the hashtag See Arthritis event. I'm Cheryl Cohen. I'm with Arthritis Consumer Experts, Canada's largest arthritis patient organization, and the host of this event through the Arthritis Broadcast Network. We are so excited to have today sitting with us in studio Dr. Mohamed Osman. Welcome to the hashtag See Arthritis event, Dr. Osman.
Oh, thank you for having me.
Yeah, it's just I'm so excited to talk to you. You tick all these great boxes of excitement for us because your role in the CRA meeting was an important one. You're teaching the next gen with some of the things that you've seen in your clinic. But before we jump in, I'm going to just introduce you very quickly to our audience. Dr. Mohamed Osman is an associate professor, clinical scientist, and consultant rheumatologist and immunologist in the Department of Medicine at the University of Alberta in Edmonton. As a PhD-trained rheumatologist, he is passionate and committed to delving into research questions that could be life-changing for his patients. So that is music to our hearts, Dr. Osman. Questions that get answered, that change people's lives and save people's lives is what we're all about. So thank you so much for joining us. We're going to dive right in to our discussion today and talk about what your role was at the CRA meeting in the scientific program. But first, tell us just a little bit about yourself. How did you, as a medical student, fall into rheumatology? What lured you to
Yeah,
the
yeah,
community?
that's a great question. So in fairness, I had no idea what rheumatology was up until I was about a second year medical student. At that time, I did one of those Canadian Rheumatology Association, or back then it was called the Abbott, CRA studentship, which
Yeah.
was sponsored by Abbott, I guess. But now it's a CRAF studentship in rheumatology. So I did one of those ones, and I was just in love. It was so cool because I had a very strong background in immunology. I was like, well, how am I going to use my background in immunology and kind of understand how this affects patients and deal with problems that really are affecting patients in a kind of a more meaningful way. So I did this summer studentship, and at that time I did it with Elaine Yakishin, who's one of my colleagues now at the
And
University of
one of
Alberta.
our heroes too. Yeah.
Yes, and Elaine is fantastic. So Elaine really kind of captures the spirit of the so-called rheumatologist superhero, I think. So she's fantastic that way. So after I did that summer studentship, I ended up going to the CRA, so the Canadian Rheumatology Association meeting, and that meeting was a blast. I saw people who I did not expect, so very, prominent colleagues of mine, and they were ripping the dance floor. It was great. It was so much fun. So I was like, man, these people are not only like fun people, but they're also very accomplished. So I was like, this is, I think, what I want to do. And then I really obviously focused my learning as a resident in internal medicine and, subsequently did rheumatology and then did other stuff afterwards.
That is amazing. So dancing lured you in. I'm happy to hear
Absolutely.
that. That is
Absolutely.
fantastic. So kudos to the CRA for putting on a heck of a dance floor during their annual dinner held at the scientific meeting. I know that you, as you mentioned, you're an immunologist, pardon me, and that's sort of foundational in especially inflammatory forms of arthritis. We have yet to discover how we shut these things down permanently. So you have a long career ahead of you, young man, and a rich area in which to investigate along with the patients who participate in your work as study participants or as your own clinical patients. When you think about your role at this year's annual scientific meeting was to present therapeutic cases during this year's residence pre-course. So in other words, you're elevated and you're now teaching the next gen about difficult, I think the cases that you presented were on difficult types of arthritis. Tell us a little bit about the pre-course and what your activity was specifically with the residents.
Yeah, so during the pre-course, I was tasked to review the various medications at the disposal of a rheumatologist that could target the immune system and inflammation. And then, of course, I'm also the abstract co-chair. So I was very involved in planning the meeting and actually moderating all the sessions and so on and so forth, but also the content itself. So I was one of the co-chairs for the scientific committee for the
Ah,
whole meeting. So during the abstract, or sorry, during the pre-course, I had two cases, and I discussed a case of rheumatoid arthritis, and I kind of, try to present to the residents that there are options. Why do you pick this drug over that drug? Why this mechanism is dysregulated in this pathway? What's relevant in this patient with rheumatoid arthritis? And what should you be worried about? What types of things should you be cautious about when it comes to treating patients with rheumatoid arthritis with various other kind of health challenges or comorbidities, as we call them in medicine?
right.
The other case was a patient with lupus, which also a form of inflammatory arthritis, just to kind of highlight some of the newer drugs that are becoming available to kind of treat the immune system and potentially some of the kind of more novel mechanisms.
Yeah. It's we try to explain to our members and people from the public who develop arthritis that there is no magic answer when it comes to therapy choice. It is the skill of the physician, you, the scientist, the physician, in conversation with the patient, with that full health history before you, that almost helps you kind of with a divining rod of sorts to try to get you leaning towards one or another. What are some of those factors? What are some of the
Yeah.
things you look at to help guide you and your patient?
So it's the patient. It's
Yeah.
primarily the patient. It's driven by the patient in every literally aspect of it. So there are medications that I think are very could potentially be very effective, but the patient and their qualities and their preferences and also the biology of that patient kind of really, in my opinion, kind of sway me to kind of go in one direction versus another direction.
Okay.
And this is where kind of involving the patient really in that decision of, well, I think we should do this. What do you think? Right? So those are the kind of discussions. And obviously, with that comes an element of trust. So the patient has to trust their doctor, and the doctor also has to trust that the patient is going to do what they ask them to do, right? So that kind of conversation is very, very important, I think.
Yeah.
And I think this really is at the heart of it. Because in rheumatology, since I guess now I've been in practice for 8 years, it's crazy. But since then, things have changed. I mean, when I was a rheumatology resident, we didn't have the number of biologics that we have today. And our approach to treatment has slightly shifted. Things have changed a little bit, but fundamentally, I think it really comes down to the patient and what the patient's preferences are.
Yeah, we like to tell people it's that art of conversation between the care provider, no matter who the care provider is, and the person who's coming in with the health challenge that really tips the scale towards success, let's say. I think I've had rheumatoid arthritis for 36, going on 37 years now, and you're right, the choices I had back in the day were very few. I could count them on one hand. And today we're using several hands and more to count the therapies available for you to discuss with your patients. In that we have you in the studio, and in that you're an immunologist, give us in just a quick minute or two what your thoughts are on CAR therapy or CAR T. And
Yeah.
I know this was a topic, not yours, but I know that in that you were on the planning committee. I know it was a big one of the big workshops held on Friday. So tell us about your thoughts.
Yeah. So I think it's exciting. And the reason why I think it's exciting is that this could potentially be a way to, at least really stop arthritis in its tracks
Yeah,
for many patients. However, it's not ready for prime time. That's kind of what I kind of emphasize to my patients. So a lot of my patients with systemic sclerosis or scleroderma, I actually have transplanted many of my patients with a bone marrow transplant, so an autologous stem cell transplant, which is different than CAR therapy. People are starting to use CAR therapies in a subset of patients with lupus, and there are a few patients with scleroderma that have been transplanted. And have been given CAR therapies. In rheumatoid arthritis, we're still trying to figure out where it will fit. Some people are starting to talk about it. I think that's interesting, but I think it's not ready for prime time. And the reason why are twofold. Number one, we don't really have a good comparator arm in our patients. So CAR therapy, just to remind everybody, is so cancer doctors, oncologists, have developed this way of basically supercharging the immune system by infecting another immune cell with a virus and making this immune cell able to kill those bad immune cells that are causing problems in cancer. It works really well in cancer. The challenges in our diseases, the theory of it, I think, is probably true, although the safety and the efficacy has not been established.
Yeah.
So
Yeah, I
this
think,
is,
and in cancer, don't they have they have more specific targets in which to go out and attack? Whereas in our area, isn't there still uncertainty about which are the bad actors in our body to go out and attack?
yeah, that's it. So that's it. So we don't really know what the best target is in our
Yeah.
diseases yet. The other thing, of course, is the safety. So, I mean, our cancer patients who are exposed to CAR therapies only live for, their expected, lifespan, I guess, with this cancer, if nothing is done about it, is relatively short. Whereas our patients live a long time. So we want to make sure that we are able to provide something that is safe, that is also effective for our patients. So I think it's exciting, but not ready for prime time.
Okay, that's a good way of putting it. Not early days, not ready for prime time. Thank you for letting me take us there momentarily. In your opinion, when you think about I was listening to you talk about how you work with your patients to guide them towards a therapeutic choice, I'm obviously looking at precision medicine. It makes me think of precision medicine. So this is kind of, I don't know if this is being unfair, but it's a bit of a crude way of getting at precision medicine in that we lack a test that says use this med versus this med. Um, how how far away do you think we are? And I don't mean to put you on the spot, Dr. Osman, but how far away do you think we are in rheumatology from being able to sit with a patient and say, well, this is what your results said, so we should match you with this therapy? Like, to me, that's precision medicine. How
Yeah.
far are we close? Is it even where we're trying to aim?
Yeah, so we're very close.
Oh,
Very close. So I mean, and I can say this, I would say we're still a little bit, far off this in implementing this, I would say across the board in rheumatology, but I would say the research is kind of pushing things in that direction. So I studied a disease called scleroderma, and this is what we are trying to actually develop in scleroderma. We are really trying to kind of develop this kind of prediction tool of saying, okay, well, this is the kind of scleroderma that you're going to get. This is probably what we need to worry about. This is why, and this is probably why we have to be a little bit more aggressive. So, for instance, one of the things that I do in clinic, in my scleroderma clinic, is I do something called nail fold video capillaroscopy.
oh my
And
goodness, that's a big word.
yeah, so and I'll tell you what it is. In essence, it's basically using a small little microscope that is looking at people's fingernails, and my patients can relate to this. And this tells me a lot about number one, do they have scleroderma if they just have Raynaud's? But more importantly, if they do have scleroderma, how active is their scleroderma, meaning how likely is it going to affect their internal organs and so on. And then what we do is we correlate this with changes in their blood where we can actually say this is actually going on with you at this time, and this is probably not so good. This is, as I said, in the research world, we're very, very close. Kind of for overall practice, I would still say we're probably not there yet, but hopefully soon.
Oh, that's exciting news, especially for diseases like scleroderma, which are very severe forms in our family of diseases. I just want you to close off our discussion, Dr. Osman, by saying what other insights? You're so great. You're such a practical speaker, and you share your information and your expertise in a way I think folks that are watching can relate to. When you think about ways to improve your patients' lives, sort of today in their own every day we spend as patients, we have to advocate for ourselves in today's healthcare system. It's a sad kind of reality, but it also helps us be stronger as individuals, that, honing our advocacy skills. What pearls would you give people in our audience to help them in that day-to-day journey?
Yeah, I mean, so people with chronic diseases, like patients who have rheumatoid arthritis or inflammatory arthritis in general, it takes a team effort,
Yeah,
right? It takes a team effort. So this starts from, the household, so, partners, kids, and so on, the family unit, but also kind of talking to your healthcare providers. And this is not just your family doctor or your rheumatologist. So, we as rheumatologists really pride ourselves in working with our allied healthcare kind of providers, so physical therapists, occupational therapists, arthritis kind of providers as well. So and others like nurse practitioners, nurses, and so on. So that's one aspect. The other one is, of course, advocacy for kind of access to care and access to medications. So we, are very, I would say, active in advocating for our patients, but I think we need help. So obviously, if you can work with patient organizations who are very strong advocates for change. So Arthritis Society, if you have a specific kind of rare disease like scleroderma or myositis, you can talk to those patient organizations. And they have these education nights, but also they advocate for patients. And as rheumatologists, we're very happy to always kind of advocate with government and impart change. And this is how change happens for our patients. Because
yeah.
obviously, with rare diseases, especially with diseases that are not in the hospital, they are not kind of in the spotlight of, this is the biggest problem. And we really do need to remind people that this is a big problem for many of our patients so that people can get the care that they need.
Yeah, I think that's very well put. It's sort of that out of sight, out of mind adage. So you heard it here from Dr. Osman, folks. Be your own best self-advocate. Lean on your healthcare team. They're here for us. Actually, they're in it for life. We have no cures at the moment, but that doesn't mean that our lives can't be full and rich and as productive as long as we are working well with our healthcare providers. Dr. Osman, we cannot thank you enough for sitting with us today in studio. You're a vibrant part of this community. We're so thrilled that you're part of rheumatology. So thank you so much to you for taking the time and for everything that you do for your patients. We are very, very appreciative.
Thank you for having me, and it's
Yeah.
always a pleasure. I mean, I actually love my job, and my patients will tell any patient of mine will say this to you. This guy clearly loves his job, and I'm happy to be able to serve my patients. So thank you.
Well, I think after this airs, you're going to have the people are going to be beating down your door to become your patient. So get ready. Thank you again, Dr. Osman, and thanks to our audience for tuning in. We look forward to another episode of hashtag C Arthritis coming up soon. Have a good day.